All right, guys, my name is Dr. Sharnael Wolverton. I am very excited about this, as usual. I love doing these things and I love talking about different subjects and different things. And today, I actually have a friend of mine on, which is kind of fun because we've never done this before. But we were just talking like we do sometimes, and it came up about her pregnancy and her whole like carrying the birth and home birthing, and I was talking about my miscarriages and just kind of the mishaps of what perspective is on pregnancy or being a mom. um, just information about births versus hospitalization type births, C-sections. So we're going to cover a lot of these bases and kind of like see if we can help, have a little dialogue about some of these real life situations, which I know many of you may be able to relate to if you're a mom, or even if you're a dad, but you have a wife or a girlfriend that has a baby. These are things that we haven't talked about on the podcast before. So I'm super excited and very honored to be with my friend Veronica today. And I just want to say hello and welcome to the show.
Hi, thank you for having me. Super excited.
Yes, and you are across the pond and it's in the middle of the night. Your baby just went to sleep, by the way. So if, share a little bit about who you are, where you are, how old your baby is, and we'll just get started there.
Yes, thank you, Sharnael. My name is Veronica, and I'm 33 this year, and I actually gave birth to my baby girl about 5 months ago. And the funny thing is that she was born right here in this apartment, not right where I'm sitting, but next to my bedroom, next to my bed, actually. And I'm actually located in Oslo, Norway, which I know me and you have talked about because you have had family. Was it you have part of your family has been in Norway or from Norway?
Yes, yes, they're Gestadalen. Where that's my ancestry is Gestadalen on both sides, and then I have some Danes in there somewhere. And I got to go visit. I haven't been able to visit you. When
Yeah,
my bucket list is to go back and see you and hang out. But anyway, keep going.
yes.
Tell me about how. So you all of a sudden you're pregnant and you have these options about home birth versus going the kind of traditional way, and explain about that and your thought process through all that.
Great. Yeah. So the what I find very interesting is that throughout my journey, especially the last 4 years, with everything that happened and everything got very focused on health. I started looking into more why or like how what creates pain during your period. And I realized that actually pain, how we perceive it, is not actually normal. We have normalized it. So I started my journey on healing my womb, and I've also had sexual trauma when I was a child. So that kind of was also carrying in my womb. So I was working throughout those kind of things to heal and get a better relationship with my womb. And then lo and behold, last year I was had a really good connection with my womb, and she was telling me, "You're gonna get pregnant soon. I'm very fertile. You're gonna get pregnant soon." And I was just like, "Okay, this is a little bit weird." And then I met my then current that at that time boyfriend, and we started dating, and then we got together. And then she kept telling me, "Well, I'm ready," and I was like, well, I don't think I am. But then I believe very truly that it doesn't matter how careful you are or not careful. When a soul is supposed to come, it will happen, and that's happened. And I felt it before I even took the pregnancy test. I was like, something's different within me. I don't know what it is, but I think I might be because she got a little bit quiet at that time. So I was like, she used to be very like, hello, hello, I'm ready, and then she got very quiet. And then I wasn't even late on my period, but I decided to take a test because things were happening and the relationship wasn't going as I wanted to. But I was just very clearly feeling, okay, something's still different and I need to figure out what it is. And the test was positive. And the moment I got the pregnancy test, prior to this, I had already spoken to my then partner and with myself because I did have an abortion 9 years ago. And I was very naive, thinking, oh, well, if I end up getting pregnant, you just have an abortion. It's very normal. But then having it, I didn't realize how connected I would be on a soul level to the baby that I then carried. And I also believe that if that baby was supposed to come through, none of the things that you would have done would have been successful. Like something would have maybe blocked me from going to the appointment to get the abortion and stuff like that. Something would have come in the way if that baby was supposed to come. But that baby was not supposed to come. It was supposed to just bring me a lesson. And that lesson for me that I believe is that I was um, taking very I was looking at abortion and I was very disconnected with what it would be to be pregnant and carrying a child. So after that, I had a completely different turn of view on what it meant to be pregnant. And I promised myself from that moment, I will never do an abortion again because I've got very traumatized in one way. I was walking around thinking, what if, what if? So when I got pregnant, I had already made up my mind. If I ever am blessed by God to be pregnant again, I know it's meant to be. And I leave it in the hands of God. I'm not going to be the one taking the decision if the baby's not going to be born on earth or not. That's in the hands of God. So I was just, as soon as I got pregnant, I was like, well, this is meant to be. And then I was waiting, of course, until like to say that the first trimester and to seeing like, okay, whatever you decide, God, like if this soul is meant to come, I'm ready. I'm going to get ready. I wasn't ready. I didn't feel ready, but I was like, okay, I'm going to like, I trust you. And then first trimester was gone, and I was like, okay, okay. And the funny thing I have that I made kind of jokes about on my Instagram is the fact that prior to me getting pregnant, I was constantly telling the universe, I'm tired of the work I'm doing. Like I've had a business and I was overworking myself. I burn out probably 3 or 4 times, and I kept telling the universe, I'm ready for change. I don't know what change, but I don't know how to make the change. Like, please help me. And I didn't actually expect to get pregnant and that be the change because obviously my whole life is turned upside down.
Wow.
Quitting then I had like a dog room business and I shut that business down because it wasn't aligned with me being a mother. I didn't want to be that busy, which I was with doing the dog grooming, and I didn't see that fitting into me being a present mom. So I closed that down and I was just like, okay, so this is apparently what I needed to have the change. I needed to get pregnant. But then I'm also embracing the fact that this is now my journey. I was now so blessed with being a mom. And this beautiful little girl decided that I was going to be her mother, despite of the relationship I was in didn't last. And he's currently not in or present as a father, but I'm still so grateful for her choosing me as her mother.
Aww.
So that's how it started with me, like knowing before I even got pregnant that if I'm ever pregnant again, this is meant to be. So that's how it all started when I was pregnant. I was like, okay, this is supposed to happen because otherwise I wouldn't have been able to get pregnant. And then throughout the pregnancy, I've obviously, because of the 4 last years, with everything we know about mandates and medical stuff that has been going and been pushed on us, I was very clear that I'm going to do my very best as a mother to protect my child from any unnecessary medical interventions or any other things that they are being pushed as normal. So I was looking into, okay, how can I have a most safe and peaceful birth for not only the baby but for me? And I realized by doing some journaling that because I couldn't figure out why do I feel uncomfortable at the hospital, but I realized that I went to the hospital as a very young girl doing a UTI,
Doing what?
a UTI, what
Oh,
is some kind of thing. They put me in like under sleep, whatever it is. I don't remember what it is. Yeah,
yeah.
and I didn't realize until now because I talked to my mom about it. Because I was like, why, dude? That's the only time I've actually been to the hospital and something has happened to me. Why do I feel so negative about it? And I realized my mom told me that I had asked questions. What are they going to do to me when they put me under? And she was not allowed to tell me anything. And I was like, what? And then apparently after having done this procedure, I then was told what they have done to me, and I felt so uncomfortable and violated that I got so mad at not only my mom but of course the hospital, and that had been carrying in me, in my soul, in my DNA for all
And you're,
those years.
yeah.
Yeah.
So like a trauma in the memory of your body, like you
Yeah.
just like, oh, but your mind didn't know until someone
Mm,
told you. That's
yeah.
interesting.
So when I had that, I was like, oh, that makes sense because I've never gone into major surgery or have ever done anything at the hospital that for for me to make it make sense that I didn't like the hospital.
Hmm.
But once I realized that, I was like, okay, so and I did a birth preparation course, and getting to know the information about how your body works with how what hormones you want to have present during birth and not, I realized birthing in a hospital wouldn't be ideal for me to be able to actually have a safe birth. I wouldn't probably be able to relax properly, going into what we call the birth bubble, where you kind of like just go into a flow with your body and you're really present in your body. You're not in your mind, but in your body. So I was looking into, okay, how can I have a home birth then? And then unfortunately here in Norway, we don't have that part of the public official system as a home birth. You then have to hire private midwives to then assist you for home birth. And that's what I did. I started researching, okay, how can I find private home midwives?
I got a question. I want to stop you.
Yeah.
You said there wasn't a safe way to do it at home, and yet culturally a lot of people would say the absolute opposite. Can you speak into that a little bit, because I get what you're saying, but for those who are, I mean, that's what we used to do back in the day, but
Mm,
there is a lot of fear around doing home births because, oh my
mm.
god, what if something happens, or what if this, and then la 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 la, like, so go into your thought process of that.
Yeah. So what I've learned from doing my research and then speaking with the midwives, because the midwives team that I chose to have actually worked in a hospital. I think they started working privately a year ago because they had a separate section, a midwife, what do you call it, midwife? Yeah, they were in control. The midwife section, they were in control of it, and they would have working more differently and more in line with how women are supposed to birth rather than typical hospital. And what I mean by that is that they were working more like supporting you as a woman, like you are meant to be doing this, you are born to do this, you were created to do this. Your body knows exactly what it does, instead of the typical medical system where they're like, oh, you're kind of like you've been doing this too long now. Now we gotta like induce you and we gotta push the baby out, like get it out before it may be ready. So a lot of people think that home births are unsafe because they hear about all these what if stories. What if this happened? What if this happened? What are you going to do then? And actually, the actual truth is that once you get it to the hospital, the best way to explain it is that you can imagine a lot of people have trouble going to the bathroom and making a poop in public places. They
Mhm.
feel more comfortable doing that at home. And that's how it is with the hospital and your body, how it works with your uterus and how, baby being born. You feel more calm in your safe comfort of home instead of going in a public space as a hospital where you actually don't even know the people that are coming into the room. It may be strangers. You might be 1 in 100 might be lucky to have the midwife they work with or saw at the hospital for any of the typical checks, but most of them are you just it's kind of like a lucky number of like, oh, you're on duty today, okay, I don't know who are you. And for me as well, I didn't want to have a male doctor there, and that would be out of my control. I could have asked for a preference for female, but if a man is on duty that night, it would have been a male doctor. And there is also the domino effect when going to a hospital, as they are on a time schedule. If you are in give this, they have like a schedule where and routines where you enter the hospital and it goes a certain amount of time. If you haven't had the baby, then they kind of want to push you into like, okay, we then have you to induce you, and then women aren't informed that if you are being induced, there are risks with that. So, for example, you then a lot of people then have end up having a C-section because you're being induced, and then maybe the baby heart rate drops or something like that, and then they have to have an emergency C-section. But in a home birth, as long as you have a healthy pregnancy, the risk of having anything happen is very, very small. And actually, you can prevent a lot of unnecessary things happening by having a good uh, female support system. Because that's what I would recommend, because obviously you feel a lot more safer when you have experienced birthing mothers around you who knows how it is to go through a birth. They know what's normal and what's not normal, and they can guide you and then give you comfort when you're getting like a little bit, especially as a first time mom. If you're there and you're like, oh, I'm feeling this, is this normal? And they'll be like, everything is normal, you're doing great. And you're like, okay. And then you go back to your body and being present in your body and trusting that your body actually knows and your baby knows what to do to come out, and being patient as well, knowing that the baby will come out when it's ready instead of trying to push it out too early.
Yeah, you're bringing up a lot of good points here, and I appreciate your vulnerability and just sharing from your heart. One of the things that we talked about that led to this conversation in the first place is I was told, like, I got a C-section my first birth, because that's exactly what happened. Is she was actually born blue and without a heartbeat, and they had to resuscitate her. But they did what is it?
Pitocin.
That to
Yeah.
help. Is that her?
Yeah, I think I have to go and pick her up and have her here because she's very crying.
Go ahead. Go ahead.
Yeah.
Yes. Um, I was sharing with her off camera. They did Pitocin for me to kind of like speed things up, and I don't know how that affects the baby. You would think there would be some sort of counteraction with that, but what I was told is if you have a C-section once, then you always have to have C-sections from that point on. Oh my God, look at her, so sweet. Oh my gosh.
I'm just gonna keep her out of sight.
Yeah, that's okay.
Like this.
There is such a rise in C-sections right now. It used to be one out of like 50,000 people would get a C-section, and then it was like one out of 10,000. And now, do you know that it's one out of 3 births is a C-section? They're really pushing the C-section thing, and I could see, the kind of romance of it, or the structure of it, where I know my need to know a time schedule and need to have a plan and those kind of things, like in such a way, it could be appealing to someone to know, well, this is the day we're scheduled to have the baby, and then you could plan all around that, and you know exactly what's going on. But there is a lot of downside to the C-sections. I mean, it messes with probiotic stuff, all the reproductive stuff. They do tell you that if you have a C-section, that from then on, any other pregnancies have to be a C-section because of the way you're sewn up. It's not, the wall may not be as strength, and they try to tell you that you could like bust open the wall with the pressure of the next baby. And there's all these other things. And so I've heard both sides. I've heard some people say, no, that's not true. They had a C-section and then they had 3 births after that, or 5 births after that, or whatever. So it's hard to tell like what is actually about the money, because there is so much money. It's like back when I was doing it, it was like 10 or 12,000 for a C-section, which is probably way more than that now, versus an actual just regular birth at the time was around 2,500 or 3,000. So quite a bump in what the pay is out, as far as insurance companies, or if you're paying out of pocket. But go into a little bit about what happens once you have a C-section, and how that affects the mother regularly, with all the other complications.
Yeah, so one thing that's very interesting with that as well is that what they kind of use as an way of fearing you into thinking that once you have a C-section, you can't have a regular vaginal birth, is that you can what do you call it, not abrupt, but you can burst your uterus, like it can break, or that was not break, but yeah, like it will kind of like, yeah, it's not meant, you're not meant to then go through the vaginal canal. But that's actually just for them to fear you into, because yes, it is the possibility if you have two birds too close to each other, if it hasn't healed enough. But I have a friend who's given birth like for the 4th time now, and she had 2 C-sections and then 2 natural births. And the last one were all natural without any medication at all at a hospital, because she wasn't unable to find a midwife that were able to work with her at home. due to her having 2 histories of C-sections, even though her third birth was vaginal, they didn't, because obviously if you are a practicing midwife, you don't have to follow the rules of the system, unfortunately. Which is kind of sad because I know a lot of midwives would like to work more freely, but they have to follow certain things without to avoid being punished, basically. Um, but then obviously, when you have a C-section, a lot of women don't understand as well. Like, because I've noticed in my generation, not that I'm a lot younger than you, but it's very very focused on like um, the outer appearance. They think that you're gonna tear and ruin yourself by having a vaginal birth. That's why a lot of women are like, "Oh, I'm gonna have the C-section, then I'm gonna avoid tearing and breaking myself." And it's kind of like, well, you wouldn't tear if you actually are following your body and trusting your body and not pushing when you're not supposed to be pushing. And for instance, you're not really supposed to be pushing. Your body will push. You're just supposed to breathe through it and allow your body and your uterus to do the work and just allow it to like naturally open up, not at the speed of the hospital where they wanted like you to like, dilate like that, but actually allowing your body to go like opening up for the baby to be like, okay, I'm ready now. And then we don't talk about enough about the risk of having infections in the C-section, and even how you're kind of like, how many layers? I think they say like 8 or 9 layers of or like skin and tissue you have to go through to get to the baby. How is that less of a risk than going the natural way? That doesn't make sense to me. But it also aligns with like a lot of women wanting to have like the baby on a specific date. They don't want to go being having the unknown of like when is the baby coming, as well as I see a typical trend with breastfeeding as well. Like we hear women talking about, oh, when you're breastfeeding, your booby is gonna get saggy, so I'm gonna rather have formula, not knowing that the magic of breast milk is literally magic. It adjusts to what baby needs. If the baby is having a little bit of a flu-like symptoms, the body will give the your body will give antibodies to the baby to help him, like a boost immune system and all these kind of things, instead of like formula, which is basically a lot of chemicals. Let's be honest. It's not really like, it's a great thing for emergency when you have no other options. But I see so many moms. This is where I know I trigger a lot of moms because I speak very openly about that. I don't like the fact that moms choose formula as the first option. It should be used as an emergency when you have no other options. And I know a lot of moms as well use formula because they're like, oh, well, I need to think about my mental health because they may be struggling with nursing. And I did that too. I had 10 weeks where I was literally in so much pain nursing that I was sitting nursing and crying and screaming to myself. I tried to scream into a pillow because I didn't want to scream in her face. But it was because I knew, no, I knew breastfeeding is so good. It's so the best thing baby can have. And I know I wouldn't even want to think about having to clean and sterilize bottles and mixing stuff. I have the food station is right here. And I kid you not, on I think it was, yeah, when I hit 12 weeks, boom, the pain was gone. And I was like, oh my God, what if I had given up on those first weeks and choosing formula because I thought it would be better for me? Yes, of course, I was struggling, but I knew in my mind and my body was like, breastfeeding is the best thing. I know my body can do this. I'm producing milk. I'm gonna like release the stress and trust my body. It will get better. Everybody tells me it will. It's natural to have pain. We are different. Somebody has pain a lot shorter. Some experience pain a lot longer, but it will get better. It will get better. And then I trusted it, and it happened. But going back to C-section, a lot of women, especially when I see it as a trend, like you mentioned with C-section, a lot of people, women go, they are kind of like very focused on the due date, estimated due date, and they're expecting the baby to come out. And I also see a lot of moms where I didn't feel that way, where when we're getting closer to week 40 or even like 38 week or 37, they are feeling so heavy and they're like, oh, I'm so ready to get the baby out.
Mm-hmm.
I was walking around thinking, this, I don't know if I'm ever going to experience being pregnant again. So this might be the last time I feel her inside of me, and I want to cherish every single moment of it. And I also trusted that she's going to come when she's ready, not when on my time schedule.
Yeah.
Obviously, we had a connection. I knew she was going to be a June baby. I knew she wouldn't come before that. And my estimated date were in the beginning of June. So I was like, no, but she's telling me like she's not going to come in for until June. So I knew, no, I know it's going to be June, but I'm also on a schedule where I'm like, you're going to come when you're ready. It's kind of like when you're baking something in the oven. You're not going to rush it. You can't rush it. It will be done when it's done.
Yeah. Yeah.
So
No,
even
I can see, like I said, I can see the appeal of wanting, a plan on your calendar and telling people take this day off and all of that, but nothing can replace nature. And when there is a vaginal birth, which I haven't got to experience, there's all different kind of things like flora and different things that when they pass through the vaginal canal that actually help with immunity and calming down the heart rate, and just there's so many. If you guys dig in and really look at it, there's a lot of benefits to just being natural and doing the natural thing, just like eating naturally, or exercising or being in nature. This is a part of what a woman can do, and we have been doing it for a long, long time, and that's just part of it. And even going with the breast milk versus formula, um, there's definitely a rise of cosmetic surgeries going on in the land, since even I was a kid. In my early 20s, I actually had some tumors removed and in my breast, and they pulled them out, and they offered cosmetic surgery for reconstruction. And I took the bait and did it, which I sincerely regret. And it caused a lot of problems. And I eventually got them out, replaced them because they talked me into just replacing them instead of doing that. And then those had problems as well, mold, infection, parasite, just inflammation, achy all the time, leakages, like all that stuff. So had them out again, had to go through the whole detox process and stuff. But what I was going to say is they don't tell you that when you have any kind of augmentation there, that it could affect being able to breastfeed. And maybe not everybody. I do know some people who have breastfed when they've had a boob job or whatever. But in my case, um, with everything that happened, it actually limited me from being able to breastfeed. I was able to get just a little bit all the time, and I would do as much as I could every time, and I would pump and I would do all the things. But it caused a lot of stress and agony because I really always wanted to breastfeed. And they promised and told me, oh, that's not going to be a problem. Of course, I wasn't thinking of if I'm feeding a baby from, something that's synthetic, and maybe there could be some leakage or whatever, and it could cause problems. That wasn't crossing my mind in my, early 20s. It just wasn't, a part of my mindset. But when, here I am 30 something, and struggling and crying and being upset and feeling guilty because I couldn't get enough milk even to come out. I mean, just drops or whatever, not to be too TMI. And I really, really wanted to breastfeed. And so we had to use formula, and I know that some people have to. But the synthetic formulas, I mean, that versus breast milk, I mean, allergies are better, immunity is better. Anyone who can breastfeed and anyone that comes from an actual vaginal birth, those babies are going to thrive way more in immunity than any kind of baby in a C-section or any kind of baby without breast milk. There is a reason why we're created the way we are and what we do. And so, yeah, I just wanted to throw that in there. But yeah, cosmetically too, you're hearing about people who do the vaginal and then they want to stitch everything up down there. And so I have heard people being like, oh, well, I don't want to do that because I don't want to mess with my sex life or whatever. And it's just like, or the sagging boobs or, things like that. So anyway, go back to what you were saying. I took down some notes about, you were talking about it being safe and your mindset about it being more safe in your own environment with your own people. Did you do it in like a bed? I know some people do like a floating device or a swimming pool, or like how did you do it?
So prior to getting, well, in the early days of Be Pretty, I was also looking into having a doula. And I'm obviously, since I'm here with you talking to you, we are both very spiritual in the way where we are into energies, frequencies, and all of these more like what they call alternative stuff. Well, we call it more the foundation or the what's actually normal, not alternative. And I was looking into a doula, and I trust in divine guidance. So obviously, my chiropractor that I go to, he and his wife had used the doula, and they were like, "Well, I think you're in line with us. We like, you like crystals and stuff, and the doula we use is very like working with energies and stuff. Like maybe you'll align with her." And I was like, "Oh, let me contact her." Perfect. She was Me and her matched right away, and we were working a lot with breathing and how I was connecting with baby girl, because I knew from day one as well that it was a baby girl, even though I didn't care about the test, but I was obviously I'll be like, oh, I hope it's a girl because I know about girls. I don't know about boys. But I was working with a doula, and we were working with like connecting with baby girl and working on how you're breathing into your womb and breathing down. And we were practicing how I was going to use my breath during birth whenever I had a contraction, actually working and breathing down into the uterus and down into the vaginal canal, and using that during birth as well, with being aligned with the body, going down and kind of not pushing, but a way of like being grounded and grounding down. And I found that being very helpful with me. And whenever I had a contraction, I was obviously walking around the apartment squatting every time I had a contraction because that felt good to me, using the gravity pull, and while I was breathing down and like going with the body, that felt natural to me. And yes, I did have a pool set up because I wanted to. And in my mind, I was like, yeah, I'm going to give birth in a pool. It will be less kind of messy because if anything comes out of me with the baby, it will be in the water and we're like washing it away anyway. And I did end up going into the pool, but I had then been going for 5-6 hours for active labor. No, 3 hours with active labor, having contractions frequently, and being walking around in the apartment using gravity, squatting down every time I had a contraction. So when I got to the pool, it was giving me the opposite effect. I was floating, and I was like, oh, this is not what I've been doing for hours. Like, this is not working. Yes, it was lovely to be floating around and being weightless, but I was like, every time I had a contraction, I was like, I'm not heavy. I'm floating. I'm being light. It doesn't work. So obviously, I had a plan to give birth in the pool, but I ended up actually um, leaning over my bed and having her next to my bed on a yoga mat. And catching her myself with the assistant of my midwife being behind me, just making sure she didn't drop out like on the floor. But yeah, because she was literally sitting behind me, like watching and having her hands underneath just in case, because they're very slippery when they come out. And I also want to mention that she also had her cord wrapped around her 3 times. But I have been watching a lot of videos, and I was not stressing with that. I knew it's very normal for baby to have the cord around their neck, and as long as you're not stressing, you just gently remove it, untwist it, and then she's fine. And she was not blue or anything like that. So I was very calm, and I got a lot of comments from my midwife saying like, "Wow, you were really like you just the cord is there. Let's unwrap her." I wasn't like, "Oh my god, she's strangled." Like, no, nothing like that.
Yes. Yeah. I mean, it can be dangerous. That's what happened to my oldest is we were pushing and, every time it was choking her and eventually there wasn't a heartbeat at birth. So when she came out, or when they took her out, I should say, that was my first time to have a baby, and I only saw like what goes on in the movies and TV, and normally, that comes out, and then you hear the crying, and then, and so I had this like sheet up like they do to separate when you have a C-section. I had an epidural, so I'm awake, but they're doing what they're doing, and then they're saying, "Oh, the baby's out" or whatever, and it's quiet. And I was freaking out because I was just like, wait a minute, isn't there supposed to be crying going on? What's happening? What's happening? Well, I didn't know on the other side of that sheet, I'm seeing like my mom and my ex at the time and their faces. And I'm just like, what? And they were over there doing CPR, doing everything to bring her back. And she did come back, thank goodness. But my second one actually had the cord around her 9 times. And so they lifted her up, and then they just did this like 1, 2, 3. And I was just like, whoa, this is, but yeah, it was scary a little bit for me just because of the first time what happened. That I was like, oh my gosh, 9 times, versus just a couple, or I don't know how many it was the first time. They didn't tell me, but yes,
I want to point out though that what I've researched that having just the cord around with nothing else in affecting it, it's not dangerous. It is when you have the epidural, other medical things affecting the baby as well, because a lot of people and a lot of moms don't know because they're being told, no, 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 if you have an epidural, it's not going to affect the baby. It doesn't go through the bloodstream, and it actually does. There's a reason why the heartbeat of the baby stops or slows down a lot when mom are affected with any amnesia, no, anesthesia, not
yeah,
amnesia.
yeah,
Yeah,
probably and amnesia too.
yeah.
But yeah, I mean, I could never get that part where it was just like when they say, "Oh no, it won't hurt the baby," but
Mm,
at the same time, everything you eat, everything you smell, like, being around someone with cigarettes, like all of that kind of stuff, that affects the baby. But yet, putting something in your body that makes you literally numb from here down doesn't affect the baby. Like, I beg to differ. It seems,
yeah.
how is that not possible? So,
That's why I mentioned earlier with the domino effect, because from what my standpoint and how I look at things, you can imagine the baby being there. Yeah, I feel mommy. Yes, okay, mommy's maybe breathing a little bit differently or like stressing a little bit, but I feel her. And then all of a sudden, where's mom? I don't feel her anymore. Like, what's going on? The connection is kind of like numbed down. Maybe they feel like it's lost, but it's very numbed down because of the drugs. And then baby heartbeat either go really fast or drug she's getting or the baby is getting a little bit drugged as well. And that's when they start like, oh, the baby's not breathing. Oh, we have to put on you on a drip. Oh no, baby's still not coming out. Oh, we got to do emergency C-section. Instead of like if you just avoided the drug to begin with, baby will still be connected, and other things may affect the baby to have a higher heartbeat or slower, but it wouldn't be the drugs. Like for me, the reason why I also stepped out of the pool was when we had to reheat the water because it was getting a little bit chilly in there. Obviously, she took the water, and I was like, "Oh, this is so warm and lovely." But the baby was like, "Whew, it's getting a little bit hot in here." So she had a little bit of higher heartbeat than she would have liked to have her have, and so we had to step out. So yes, that was the factor for it. Wasn't drugs; it was just the water being a little bit too hot for her. It was a little bit like she's inside of me, swimming in the pool, and it gets a little bit too hot.
yeah, yeah, no,
um,
two June babies also, by the way. Both of them
yeah.
were born on Father's Day, 7 years apart exactly, which is interesting. And I spent a lot of time before we had the baby in the pool because not only is it really hot in Louisiana, but just the weight of the baby, like you said, being in the pool just helped with gravity, make me feel like a normal person for just a minute. We did not have the baby in the pool, obviously, but I'm just saying I was in the pool a lot. I was going to mention that I've done some research here recently or in the last decade or so about dolphins in the pool and the sonar um, waves that dolphins can help with birth of
Mhm.
just putting a pregnant mother in a pool with dolphins and having the baby like that with dolphins being in there and being around. I mean, obviously not a little pool in the apartment. We're not going to have enough room for a dolphin in there. Maybe a little miniature fake one. But have you heard any of that before?
A
Have you?
lot of it, yeah.
Yeah, it's something
That's
about the frequency of their voice or their sound or just their being. It helps with pain and
yeah.
inflammation and helps bring everybody down as far as cortisol levels and stress. And I mean, they're doing it with cancer patients too, and there's people are getting healed. But um, I know this is tricky, and maybe you don't even want to go there. And if it's okay, you don't have to go there because we didn't discuss this pre-hand. But you mentioned having the abortion the first time and why you didn't want to do it the second time. And we might have a little different idea about it, but I have also there I met a young girl with I was going to say Stevens, Bob Jones, who used to see babies. Like she was like a medium, but she was 4 and 5 and 6 years old, and still seeing like the cloud of witnesses just walking around. Like she somehow has this supernatural gift to see babies or people who have passed And one of the things that she would talk about is the garbage baby and or other babies that she would see and talk to. And they would ask her, well, why is she called garbage baby, or why is this other baby called this or whatever? And she said, oh, her mom had me and then they threw her in the trash, or there were other babies who didn't quite make it to earth, but they still wanted to be named, and they still had this connection with their mom, and that they actually chose to come here even though they knew they would be aborted. And but on a physical, so I want to touch that a little bit on how you feel about that. And then also I'm assuming you did, like, I guess like a DNC, but after you had that physically, was there physical pain involved still? I mean, did you continue to bleed? Like, I'm sure there's a lot besides the mental that you dealt with. Just because I've had miscarriages, and one of the things that I did not know about a miscarriage until I had it is, even like, in my mind, I just thought when someone has a miscarriage, or when I would hear that someone had a miscarriage, I kind of thought it would be like, oh, it's over and the baby's out, no matter how old, 12 weeks, 24 weeks, whatever, and then it would be over. But what I didn't know is when people start to lose a baby, it is a process of miscarrying for weeks and weeks and weeks. And I could be going to the store or going here or going there, and then every time I'd had to go to the bathroom or whatever, another little piece would be out, and there would be constant, bleeding and things like that. It's such a terrible traumatic situation to go through that, because it goes on for so long unless you get a DNC, which I don't know if that's the best way to do that either. I've only had to do one only because of emergency situations, but it's so traumatizing to just make it be over. I'm going to get emotional, but just, to go through that over such a long period and try to put on a happy face while all the people are around you, and you're just like, yeah, nobody even knows in this room that I'm literally still losing the baby. And and it goes on and on and on, and it's just like, when is this going to be over? And it's just such a terrible thing. If you I'm sure there's people watching who've had to go through that, and it's terrible. But so two parts: the spiritual side, and then the physical ramifications of having that abortion.
Yeah, because I don't know what you mean with what you named it, because I know there's two different ways. You have one that if I think it's early enough, you can just take a pill. And I think maybe you also put a pill inside of you and have it, like, but then you also have the other one where you have to like scrape it out. I don't know how it is. If it's you're early enough, you then took the pill, because I took just the pill, even if it's just not just a pill. But I remember very clearly that, because at the time I was very clear, like, this is not, like, it's not meant to be. I can not even imagine having it right now, so I have to do it, even if my heart was a little bit like, oh, I don't really like doing it, but everything else was just like, you have to do it, like, you have to. And I just remember in the hospital that I actually think it was a male man who did the ultrasound just to confirm that it actually was a pregnancy. I just remember him not letting me look at the screen, because he was like, "No, you're already come in here, chosen to have the abortion, so you're not going to look at the screen." And till this day, I'm like, I'm so grateful I didn't look at the screen, because I might have been like, "Uh-oh, no, abort mission. I'm gonna keep it," because I think I would have been, because I noticed how I felt when I had the first scan at 8 weeks this time, because I wanted to confirm it early because of different personal situations. Just seeing it on the screen made it a lot more real, and that as soon as I saw it in the heartbeat, I was like, "Oh my god, I could never ever again make the decision to end it." So at that time, I was lucky enough to not watch the screen, but I was told you take the pills, and after a certain amount of hours, I think it was, you will then start bleeding. And I think they may have told me like, yeah, you might bleed a little bit a few days after, or might have a little bit of pain. But nobody told me that I will have to use kind of like a diaper for over a month. I think it was actually 2 months. I was not allowed to put anything in, like no tampons or nothing like that. And I was just walking around bleeding, like not heavily after a few weeks, but the first week or two, I was bleeding a lot. And that, like you said, is a constant reminder of, yeah, like I just a baby is passing through me. Even if it's very, very small, it's still a little baby. And having that constant reminder is something that a lot of people don't understand. For me, that made it a lot worse. If it would have just been a pill one day and then it's done, it probably would have been less affecting me on a soul level, because it would be like, oh, quickly done, and then I forget about it. But having that for go on for a week or two or three or four or five, six, seven, eight, that was a constant reminder, like you had a baby inside of you and you ended it and you removed it. Even if I understand now that it was part of that baby's journey to come here as a lesson, they chose to just experience that on coming here and then going through, uh, like the baby, the child you mentioned of being the garbage baby. Like they chose that route for coming in as that lesson, because I was very much needed that lesson at that time, as I was very naively thinking, as many of my friends, oh, if you get pregnant, no worries, you take the plan B. If that doesn't work, oh well, you have an abortion. Very lightly talk. And after that, I was like, abortion is not lightly. You don't take that lightly. Some still, some people still do, but me personally, I changed my whole perspective on doing an abortion at that
Yeah,
time.
yeah. No, me too. I just saw an interview with this girl was so upset about the election and stuff, which is a whole different topic, but she had said that she had 45 abortions. And I mean, ugh, like, can
Wow.
you, I just, that's just, it's, for me, I'm with you. It's life. And I think a lot of people do see the screen and change their mind. And that's why, there are organizations out there that will allow free sonograms and allow people to see, because maybe they will change your mind and save a life. And obviously there's different reasons why people may choose to go that direction. Whether it's a rape or incest, or there's a major complication with the mom. I got really, I was miscarrying. One of my miscarriages, I had to get the emergency C-section. The emergency DNC, because my life was at risk, and the baby, the heartbeat was over. She was already gone. And then I actually had to deliver one at 20 weeks by myself in a bathroom, which
Mm.
was not. It was very traumatic. So
That's not supposed to happen either. That you're not supposed to go through stuff like that,
yeah,
right? And I have also issue with how we mix the word of abortion into, like, when there's an emergency situation, it shouldn't be called abortion, because people will be like, it's not this, even if the process is similar.
it's a
One
deep.
thing should
Yeah,
Yeah, it should be like, if you're choosing to end the life and remove the baby, that should be a chosen abortion, and then should have a different name. If you're like I think, yeah, you have a different name for it in American or English, miscarriage, but in Norwegian we have, like, it's still named abortion, and it shouldn't be named abortion. And
yeah,
like if your baby stops breathing or heartbeat at a certain amount of weeks, and you have to pass it through, it should not be called abortion. It should be called something completely different, so you don't mix it up, and people can be like, "Oh, well, you had this amount of abortion," and you're like, "Well, it was not my choice.
right,
The baby decided it was not
right,
um, healthy enough to enter this world." And I
yeah,
also want to say something when you said about, I know a lot of people use different traumatic experiences as reasons to why they should have be allowed to have the access to abortion, like for example rape. And on a maternity meeting, I actually met a mom that had a friend that, I don't know if it was a friend or the friend of a friend, but she had experienced being raped and got pregnant. And she told me that she had said that if she didn't have the baby, she probably wouldn't have been alive. That baby, and her choosing to keep that baby, even though it came from something as traumatic as that, it saved her. And that's how some people forget that it shouldn't just be a traumatic experience and just negative. Sometimes it can actually be a reason for the baby coming
yeah.
through.
I agree.
And yeah,
Yeah,
and I also felt something other thing with, I see when people have like X amount of abortions. I felt very strongly a sense of like they might be stuck in a loop where they haven't learned the lesson, which is why a soul is coming through to try to like break the loop, but they're
mm,
still stuck in the loop of just having the abortion, and
wow.
not maybe having the abortion, like I had an abortion and then have the, whoa, I don't want to do it again. Or some might end up having being pregnant and keeping the baby. like either way. But when people are stuck in having that many abortions, I wonder if there's a lesson going on loop where they aren't like realizing what they're doing to themselves because they don't understand that you're actually affecting yourself negatively by having abortion. Even though we make it seem like something simple, just taking a pill or something like that, you're negatively affecting your hormones and your body and your womb.
So I've talked to people who had a rape or incest and still had the baby, and similar, where they were just like, thank God. And this kid ended up being, amazing, and interview some of the kids who went through it. And then also, I've also talked to some people who've had an abortion or two and then weren't able to have kids when they were ready to have kids because it did something to mess them up in the process. So this is a big, very complicated subject. All these subjects are very complicated, and I'm sure there's going to be a lot of feelings either way about all the different things. But I know you got to go, and I got to go too. And I am just so honored and appreciate very much your being so open and willing to share some of these very complicated, complex, difficult subjects. And you're very brave, and I'm happy that you went through and had this beautiful child. And we all send you amazing, beautiful, good vibes, doing your mom thing. And you're beautiful, and just a great hearted friend. And I know that tell me her name again.
Eliana.
Eliana, that's right. Yes, I was going to say Ellie, but I was close.
That's her nickname.
Oh, okay. Okay. Well, Ellie, we love you. And Veronica, we love you. And, for those of you guys watching, share this, because there may be some people that could learn something or remember something just by hearing some of these things and understanding a little bit more about nature and doing things more natural. And, there's a lot of positivity about doing things just regular, like old fashioned, old school, like our grandparents did. And hopefully it took away some of the fear factor on some of these mishaps. But thank you again, Veronica.
Thank
And
you for having me.
all the way over in Norway. And next time I go, we're definitely going to connect. And
Definitely.
thank you guys for watching. Hit the like, hit the share, do all the things fun. And you can find more information about me and the books and all the things at drsharnael.com. Go to drsharnael.com, and I have 5 books there, lots of workshops. My podcast is every Thursday at noon, and I would love to have you guys back. Thank you so much for being with us today. All right. Bye-bye.